Estrogen dominance is a bear, but there are actions you can take to reverse it. Estrogen is important for so many things in the body, but just like anything, you can have too much of a good thing. Estrogen and progesterone are the two main sex hormones that women have. Estrogen has hundreds of functions, including primary responsibility for female physical features and reproduction. Estrogen is involved with breast growth, growth of pubic and underarm hair, start of menstrual cycles, controlling the menstrual cycle once it's begun, and of course is vitally important for childbearing. But it also keeps cholesterol in control. It particularly is important for protecting bone health, and it affects your brain, including your moods, as I'm sure you know, bones, heart, skin, and other tissues. Progesterone prepares the womb lining for a potential pregnancy after ovulation. It triggers the lining to thicken to accept a fertilized egg, and it also prohibits the muscle contractions in the uterus that would cause the body to reject an egg. Balance is absolutely everything. As we get older, the hormone balance between estrogen and progesterone changes. It becomes easy to have too much estrogen in relation to progesterone, and this is called estrogen dominance. Frequent headaches, mood swings and anxiety, weight gain, bloating, irregular periods, difficulties sleeping, unexplained fatigue, severe PMS symptoms. No wonder we feel so rough. We make it through childbearing to have this happen. So here's the good news. There are things you can do to reduce estrogen dominance. Number one, eliminate. Estrogen is broken down in the liver and then delivered to the colon for elimination. Pooping 2 to 3 times a day means everything gets cleared out effectively. Constipation, on the other hand, gives those metabolites a chance to be reabsorbed into the bloodstream, and that can build up levels of estrogen. Number two, hydrate. Drinking filtered water helps clean you from the inside out, supporting that elimination process and lubricating cells to help them function well. Chicken, lamb, beef, eggs, milk, butter can all contain hormones. Choose hormone-free meats and dairy products. Number four, sweat it out. Exercise is vital for so many reasons. One is to detox the body by sweating the molecules onto the skin surface. Exercise is awesome for also massaging the colon to keep things moving along. And when you sweat, rinse off immediately. There's no point in sweating all those metabolites out and then letting them sit on your skin, ready to be reabsorbed. As progesterone levels start to drop starting in the mid-30s, yes, as early as that, some women benefit from a little supplementation of progesterone. Pick high-quality, bioidentical progesterone, but always work with a doctor to make sure you're using the right amount. Balance is everything. 6. Cut carbs by half. Carbs, oh, lovely carbs. They make our brains feel so happy. As we get older, though, we don't burn off the carbs as easily, and they get stored as fat. Hormones love fat. The hormone molecules jump right into those fat cells and sit there, and before we know it, estrogen levels are rising. Number 7, go BPA free. Beware of xenoestrogens, the chemicals that look and behave like estrogen that we find in many plastics. BPA stands for bisphenol A, a chemical that has been used to make plastics that store food since the 1960s. Always choose BPA-free plastics. Kjaer hormone creams are some options for you. For balance and to restore our progesterone creams, they are physician formulated and designed for women of all ages to help promote effective balance and health optimization. They are moisturizing, non-greasy, and scent-free. You can read more on our website along with lots of other articles. So how do you use it? You apply one single pump to the thin area of the skin, such as behind the knee or the inner wrist. How often you use it over the course of a day and over the course of a week or over the course of a month depends on age and the guidance from your healthcare practitioner. Progesterone is protective of the breast, brain, and heart, and can be safely used for many years under the guidance of a practitioner. And we just want to reinforce this. Always check with your provider. These are general guidelines. Good luck reversing your estrogen dominance.